morning, everybody. Welcome to the final day of Network 2021, the largest discussion platform for center-right think tanks, brought to you by the Wilfrid Martin Center for European Studies. To kick things off today, we're joined online by our moderator, Filippo Cristoferi, who will be guiding us through this panel titled SDG 3 and its Challenge for EU Public Health Policy. Filippo is a member of the Scientific Committee at the De Gasperi Foundation. The Foundation is actually hosting this panel alongside us today. Don't forget, you can join the discussion online by using the hashtag NetAtWork and ask any questions you might have on Facebook. Without further ado, Filippo, the floor is yours.
Thank you, Mr. Larue. Let's start to introduce this panel, and thank you, Martin Center, for this precious occasion of dialogue. Good morning, everyone. We are enjoying to welcome you to this panel titled SDGs 3 and its challenge for EU public health policy. I want to start a remark that today is the World Earth Day, this year titled Restore Our Health. In the same way, we need to restore our health and healthcare systems through sustainable development, sustainable lifestyle, implementation of best practices. This panel is focused on a topic of great interest, in particular in this historical moment. Get a dialogue with leading representatives and experts who will speak at the session of the proceedings. I'm starting to introduce them to you. Here with us, two friends and two experts. Sara Roversi, that is President Future Food Institute and Secretary of the Center for Mediterranean Studies, Angelo Vassallo, and Andrea Silenti, that is Medical Director and at the General Direction Prevention and Public Health of Ministry of Health, Italian Ministry of Health. The Gasperi Foundation in the last year has deepened the themes of today's meeting, involving experts and producing studies and analysis that have resulted in a consensus paper titled Innovation and Multi-Stakeholder Systems for the Development of Health and Well-Being Policies. This work is focused specifically on Goal 3, ensure healthy lives and promote well-being for all at all ages, United Nations Agenda 2030, and which propose to the wide and widespread debate also at European level involving honorable members. The current time, marked by the health emergency, highlights some limitations that characterize even the most advanced health systems. The crisis due to the pandemic events indicate the urgent need to address issues that have been underestimated for too long in public decision-maker agendas at all levels of government. It is evident that the themes of health significantly affects the state and the quality of life of the population, with inevitable repercussions altering and modifying social and relation interaction and psychological conditions on production and economic systems. The prevention and health education are closely linked to non-communicable diseases that, combined with antibiotic resistance, are the main public health problem in the world and the topic on which the prevention and contrast strategies of the main countries of the world are focusing. According to the World Health Organization surveys, non-communicable disease kill about 41 million people each year, or in other words, 71% of all deaths globally. A new individual and collective awareness of treatment and care, the need to act on determinants of health with a view to investment and not spending, the urgency to shift research to prevention, health education, and harm reduction, the idea of one health approach that sees a multi-sector involvement of public and private, that generates investment in service and product innovation, and that is oriented toward an approach that maximizes the value in terms of health for the individual and for society, are the main task of today's event. Redesign healthcare is the watchword integrated, participatory, and multi-compartment processes with a view to One Health, valuable investment in prevention and health education. We are at the crossroad. The current health emergency is accelerating processes, forcing planning agencies and public decision-making to address issues that have been on the agenda for years, repeatedly postponed. The paradigm must therefore be changed from cure to care, from cure to prevention and education, or better, cure and prevention and education. We will be talking about this and much more today. Let's start. I ask our speaker for a first speech of 5-7 minutes. Let's start with Sara Roversi. Sara, for the rule you have and for the activities you lead, how relevant are lifestyles, especially food, in managing a healthy population? Is there any evidence about it, best practice, or tell us about your observatory? Sara?
Are not able to hear.
Hello.
I don't have. Okay, Sara.
Good. So
The floor is
thank you
yours.
so much for this question. I think that the question you asked is really critical today. And this is really, I think, also a very symbolic day in which we have to address this issue. Today is Earth Day. Since 51 years, we are celebrating on April 22nd, Earth Day. And when we talk about the health of the planet, we should consider that this is strictly connected with the health of humanity. So, when we're talking about sustainability, we have to talk about everything else that is connected with this issue. Talking about the health of the planet is strictly connected with the health of humans because we cannot live healthy in a sick environment. I think that lifestyle and implementing sustainable lifestyles, this is really one of the most crucial elements. We have tons of evidence and we have tons of examples. For example, we are in Italy and we can talk about Mediterranean diet. Mediterranean diet probably is one of the best examples we can share of implementing sustainable lifestyle. This is something that is completely in balance with what is needed for our body and, let's say, our culture, all the connection with the community, sociality, the fact of sharing, but also the health of the planet. So this is, I think, one of the most critical things because when we talk about this issue, of course, we're going to talk later also about what's the responsibility of industries, of policymakers, and so on. But we have always to consider that everyone can take action and should take action with our daily habits.
Okay, Sarah, thank you for your intervention. And now, Andrea, a question for you. Pandemic events have changed the public decision maker perception of prevention and education issue for sustainable health and lifestyle. In what direction? Is there greater sensitivity? Is changes the priority of these themes in the public agenda? Tell us what is your point of view.
This is an important workshop this morning. Certainly, the pandemic has been an important stress test for every healthcare system, not only in terms of preparedness and infection control, but also to highlight the strengths and weakness of everyday life in the healthcare sector. Finally, in the public and political debate, we are talking about prevention. We are talking about health promotion, and that is quite important also to change something in our primary care context to introduce the use of a broader primary healthcare approach and disease will be included in Europe in programs related to the investment of the next generation EU funds. For Italy, we call the programs related to the next generation EU funds, we call it the Piano Nazionale di Ripresa e Resilienza, to bind member states to invest in prevention in coming years, but the implementation phase will not be easy at all. I mean, now we are programming and planning what we are to do, and the pandemic is a sort of is pushing our new solution, but we need to implement this kind of new solution in an operational strategy. And so we need that all the stakeholders will advocate in the same direction and work together in this direction, because we need to, and maybe we discuss later about this, we need to be all together in a new vision of healthcare.
Okay, thank you, Andrea. Thank you for this first turn of question. To reason and to underline, to underscore, to reason and act as a priority of the pathological non-onset, thinking with a view to preventing disease and addiction, as we say here, aim at making sustainability investment policies in health and well-being, refocusing on public health practice for sustainable development that focus of the theme of health and well-being. So let's proceed. Sarah, in your opinion, what action are priorities to bring the issue of prevention and health education back to the center of public debate? What are we do in this sense, in this direction?
So I think that in the last few years, many things have been changed. We are all talking about the ecological transition, the digital transition, and so on. But I think that in the last 5 years, in every level of the society, we are starting to approach the issue with a different perspective. And so what I was saying before about the interconnection, I think should be applied also on this. We have different responsibilities if we talk about the legislator, policymakers, the industries, and so on. I think that in every layer, things are happening to move forward this things that is needed, this change that is needed. So thinking about what is needed from the educational perspective probably is the starting point. And when I'm talking about implementing a new approach, I'm talking about some very crucial element. In the way industries are doing innovation, there are many different approaches that, for example, we are seeing happening in companies of any different size. Even if we are talking with startup, even if we are talking with big industries, we have been working, having the needs of human at the epicenter with the design thinking in the last 20 years. And now we are starting to see industries designing innovations with a different mindset, the mindset of prosperity. So implementing the prosperity approach, prosperity thinking. So not only including the needs of humans or the needs of the consumer at the epicenter, but including the needs of the planet. So we at the Future Food Institute, we run many educational programs, and we run all the boot camps with the Food and Agriculture Organization, for example, where actually we are training we call them food shapers or climate shapers. And this is, for example, the epicenter of our methodology. So training people, but people for us are executives, are farmers, are young innovators, and of course are also educators and students, training them on designing innovation that is human and nature centered. On the other hand, we have also to address the topic of how we are educating the next generation, because if we're talking about eating habits, those are things that we have to share also, bringing food literacy as well as climate literacy at the school, in the schools, stop that and bringing those elements in every subject. When we are teaching things that are related to our health, we should talk about that when we are teaching science, when we are teaching history, because food can connect all the different elements. And I'm strongly convinced that we in Italy, we are wasting tons of opportunities and tons of values. We are wasting too much. Just starting from our origins, starting from our culture, we could learn so much on how we can take care of our health, thinking that really food is a medicine, should be our medicine. Just eating well, this is the starting point to prevent ourselves from sickness, and then impact less on the globe, on the total amount of the cost of our health, on the total budget of the country, and as well impacting less on the environment. So education probably is really the starting point.
Okay, thank you. Andrea, now you work in a governmental institution, and the question is this one. In what direction are the institution, and in particular the Ministry of Health, moving to strengthen this aspect and sectors?
Thank you, Filippo. Now I'm in an institution, I'm at the Ministry of Health, but my background is the background of a researcher. So I completely agree with Sarah. Education is the first pillar for the topic in which we are, we are talking about in this moment. It's a matter of a stewardship, I think. So when we speak about when you mention the importance of the planetary health, the concept of One Health, we are speaking about how we educate professionals and next generation of professionals. So this is, I think, is the first things to say and to do. As I mentioned before, the government of in Italy, the Ministry of Health and the other ministries are focused on the conclusion of the National Recovery and Resilience Plan related to the funds of Next Generation EU. So the conclusion is underway. So at the end of this month, it will be presented at the Commission. In the health-oriented mission number 6, there are two major components that tie several billions on investment in health and healthcare, with specific focus on the new environmental approach, primary healthcare and home delivery care, digitalization, strengthening of the healthcare workforce. These are the priorities of the component number 2, for example, and they are extremely related, in my opinion, to with the focus of the SDGs in this vision. It's about to having the courage to fly high, to have a modern vision of the post-pandemic healthcare, and to strengthen the primary healthcare approach in our healthcare system. In fact, after the pandemic, nothing will be the same, nothing. So there is no going back. There is the importance to have a vision, a leadership that are essential to create together a new way to educate people, a new way to educate health professionals, and a new way to organize and manage our healthcare system. And that is particularly important for Italy, that account for that have a national health service that accounts for more than 72% of the national healthcare spending, and it's important to orient all this investment in health promotion. So this is the challenge, and I hope that we'll be able to implement this strategy.
Yeah, thank you. Go on. The issue of value and health impact that you have mentioned, as well as the need for multi-stakeholder involvement, highlights the need for participatory strategies and action in which health impact assessment become central to evaluation pathway. This is fundamental. Therefore, it's necessary for a community of stakeholders to share common path to death clinically and socially with the main addiction, risk, and related damage of modern time. Sustainability innovation for individual and collective health and well-being is transversal across all sectors, and over this aim, I can do another question to you. What involvement could private company have in promoting sustainability innovation and lifestyle, and what role should be the public regulator play for each? For Sarah, start you, and then Andrea.
So first of all, I think that there is no option, not if or so. Imagine that there's the possibility not to tackle sustainability and these issues when we're talking about the private sector, and this is actually what is happening. And we see, as I was saying before, that we have visionary leaders that now are really changing, not only talking about sustainability as something that they're going to report in their CSR report at the end of the year, or something that they have to do because it's nice to do. Also, the private sector that now is crucial, because we all know that we need to achieve the goal 17, partnership for the goals. So to achieve the goals, we know that we have to work together. So industries now are starting to understand that this is something that they have to do if they want to see their company alive in the next 10 years, 20 years, 30 years. There's no option. So the private sector now is tackling sustainability not as a side thing. Sustainability, as well as, because I have a very broad concept of sustainability. In sustainability, I'm including all the things we're talking about now. Those industries are tackling this issue and are starting to strategize, not like they did until yesterday with short or medium term strategies, but with long term strategies. And this is the only option we have. Also, because we know that if we are not acting in this way, probably our companies are not going to be alive in the next years ahead. So I think that this is an interesting transition we are all facing. Of course, if we're talking about startup, if we're talking about small farmers, if you're talking small and medium-sized companies, this is probably easier to achieve. When we're talking about huge industries, we are tackling processes that can take years to be achieved. Then we know that we don't have time, because we are all talking about the decade of action, the Agenda 2030. But if we are thinking about food and the food system, we have to have very clear in mind that we are strictly connected with the timing of nature, because producing food includes agriculture, and agriculture needs time, agricultural seasons. Decade of action, in my mind, is less than 8 agricultural seasons ahead to change production system, to change processes, to change the way how we are producing food and feeding the planet. So this is urgent, but is happening.
Very clear, Sarah. Thank you. Andrea, what action could be implemented to promote, not as a slogan, but in really a one health in all policies approach?
Thank you, Filippo. I will try to answer in the public sector perspective, try to connect to the answer of Sarah. Certainly, the redefinition of the goals and organization of healthcare outside hospital is essential in terms of health promotion and prevention. This is why in Italy, we are thinking about a sort of new job description for the prevention department of the local health authorities. The local health authorities are the first organization the citizen can reach for their health, for assuring a good level of health. We all know that the social determinants of health and their importance. Today we have the evidence that it's important to link the global dimension to the local dimension of these determinants, a global approach that links the health of the individual to the health of the community, and link the health of the community to the environmental health and the ecosystem is needed. The Ministry of Health, for this reason, has launched a working group in this direction to try to find a modern solution to the issue of prevention and promotion from a community perspective. Also, trying to reconnect with the importance of education. Since December, the Istituto Superiore di Sanità, the Italian National Institute of Health, has been organizing multidisciplinary debates on the theme of health and communities, involving all institutions and public and private research centers, because we need, and this also is an important dimension of the component 2 of Mission 6 of our plan, the Italian plan for the next generation EU funds, is important to try to organize the communitary approach to health. So I think this is really important for this new vision of a complete and complementary approach to health.
Okay, Andrea, thank you. We can see already today some experience of contamination between different sectors are developed to generate health-oriented innovation. Evaluating them and possibly extending them with method is useful for sustainability development, including in healthcare. And so, last question for you. Sarah, tell us 3 activities that can be immediately put on field, realized to significantly improve the theme, the task.
So I think
priorities.
that yeah, I agree. The priorities need to be simple to achieve and need to be implemented pretty soon. On my side, talking about food, I think we can highlight priorities that can be achieved by everyone. First of all, we need to think about eating more sustainably, implementing sustainable eating habits. And we will see that implementing those little rules, and let's get inspired from our grandmas, from our traditions, from Mediterranean diet, implementing those simple rules, we're gonna have tons of benefits. Tons of benefits that are gonna tackle our mental health, our physical health, and we can also take care of the society. I underline this under the framework of the topic food care. Food is care, and this pandemic has been showing us how much care and food are connected. Food is not a service, food is not a commodity. Through food, we can take care of the society, we take care of our health and the health of the people we're feeding, and we can take care of the planet. Second, tackling the issue of food loss and waste. This is not strictly related with health, but is absolutely fundamental to tackle because we're wasting too much. And thinking in a circular way is going to bring benefit to our life. We're all talking about circular economy, but it's not just circular economy, because if we put the word economy, we think that is our other people's responsibility, is not belonging on us or depending on us. Circular living. We have to think in a circular way, how we are lighting our homes, how we are dressing up, also how we're feeding ourselves, and thinking about the principle of reciprocity. What we extract is also something that we have to give back, implementing a regenerative mindset. And the other topic is really thinking about the importance of food. Each time we're gathering around the table, we're honoring our past. We're experiencing the present with the people that are sharing food. Share food is important because food is sociality. And this, of course, is fundamental to take care about our mental health, the sense of belonging, the sense of community. And last but not least, we have to think about we're eating because every bite we're doing is also our future, how we're going to live in a healthier way and in a healthier planet.
Okay, Sarah, thank you. Andrea, the same for you. Tell us 3 priorities to act on the issues that we can produce effect and impact in a short range.
Thank you, Filippo. I think maybe 3 options could be sharing data, strength the educational approach to health promotion and prevention to everyone, and using a new cultural approach to One Health. This is essential, I think, and we need to work together with a mission-oriented approach. This is quite important. The mission-oriented approach has been also the approach of the European Commission. European Commission adopted this approach before the pandemic to create the mission boards. For example, in healthcare, the importance of the mission board on cancer is quite relevant. Also, the mission board on environmental needs. So, I think this is the way forward. And in the operational side, and maybe really focus on the healthcare sector, but not only, the value-based strategy is of great help, I think, because it's for definition multi-perspective, and the evaluation of impact in prevention and promotion is quite complex, but not impossible. So maybe these are the most important challenge that we need to face in the next future. And as I mentioned before, in the implementation phase, we have to be really good on the job, working together in the public and private sector with a mission-oriented approach to One Health.
Okay, I want fixed that we need a shared, transversal, and all-encompassing effort in all public policies and individual and collective actions, including economic and productive systems, to put the health and well-being of peoples at the center. Everyone's contribution is an investment that can no longer be postponed, in the certainty that everyone can generate value. Okay, thank you. Thank you. Let's see if there are any questions from participants. Mr. Larue, are there any questions from the participants?
Yes. Thank you. Yes, indeed, there are. The first question asks, points out rather, that a major strategy goal for EU health policy would be to help member states' healthcare systems respond to the challenges of aging populations and make their overall healthcare systems more sustainable. And the question is, how can these two challenges be addressed adequately? How can we help member states update their healthcare systems, making them more sustainable, helping them take care of elderly populations? And the second question asks, the pandemic, or points out as well, actually, the pandemic has pointed out that the EU needs to have a rapid response capacity so that the European Union can deal with health threats in a coordinated manner, especially with the potential for pandemics and epidemics, as this recent one has shown. And so how can we improve political communication with regard to potential risks in the future?
Okay, thank you. Andrea, the first question is for you. Aging of population and
Thank you.
And the other themes.
Yeah, of course. Sustainability and healthy aging, I think they will be both two of the most important themes before the pandemic. Now, after the pandemic, or maybe in the middle of the pandemic, everyone is able to understand why they were on the top of the agenda in the European discussion and in every member state national debate. I think, as I mentioned before, that it's really important to work for a new vision of primary healthcare, try to be as good as we are in the hospital procedures and the hospital processes, also in the primary care settings. So trying to be able to work for home delivery care, to be really effective in using new technologies, trying to reach everyone and try to answer to the needs of health of everyone in a really effective way, without losing time and trying to use and maybe are able to cover the lack of resources that we had before with technologies. So trying to use different paradigms to reach the people where they need to be reached. That is quite important. So also the theme of aging, the transition epidemiological approach have to be the way forward also after the pandemic, with a new attention for technologies.
Sarah, the second question is for you. Try to respond the question of what is important, the importance of communication. No, if I understand the question, Mr. Larue, on if you can repeat the question that you posed.
No, I think I get it. And I think that the European Commission and Europe is taking a very positive lead at the global level, communicating how crucial it is to drive the transition towards the farm to fork strategy, as well as with the European Green Deal, where actually food is at the epicenter. So communication is fundamental. Why? Because of course, if we talk about health and if we talk about food, behind that there is a huge complexity. And we have been working in the last decades, just sharing very nice claims, but sometimes those claims are hiding bad impacts. And so we need to help people to understand the complexity of the system, and also which are the impact we are making. Sometimes we think we're doing the right choice, but then if we analyze the impact that this choice is making on ourselves or on sustainability, we can discover that maybe the carbon footprint or really the effect on our health are not the one we expect. So we need to go deeper. We cannot simplify everything. And so communication is crucial, because communicating complexity is a tough job. And I really invite everyone, also the industries, because industries has a very strong responsibility on that, to help consumers to understand the complexity. And here, I think that becoming more accountable, becoming more transparent, try to measure what are the impacts is absolutely crucial.
Okay, thank you, Sarah. And thanks to everyone, experts and participants. Thanks to Mertens Center for these important meetings and opportunity. It's a dialogue discussion that begins today, but needs to continue in the future. Mr. Larue, the floor is yours for the conclusion.
Thank you to our moderator and our panelists for this insightful discussion. Dear audience, we'll now be taking a short break before enjoying the final panel and the final closing remarks delivered by Bettina Rausch, the president of the Political Academy of the Austrian People's Party. See you at 11:45.